Hi, welcome to East Meets West, an integrative approach to men's health. I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and practicing mostly in Whitefish, Montana, and Fairbanks, Alaska. Mike?
Hey, and I'm Michael Johnson. I've been practicing for 15 years as an acupuncturist. I'm licensed here in North Carolina. I'm nationally certified with the Acupuncture Oriental Medicine Council, and this is going to be exciting because this is a topic that doesn't get discussed enough. So I think it's time it gets talked about.
Yeah, absolutely. So, what exactly are we talking about today, Mike?
And what's killing men? You got to wonder because you always look in the news or you see family and guys are dying
Yeah.
way too young. You get that 60, 61-year-old that looked like they were going to be invincible, and then they have a massive stroke or heart attack or something happens to
Mhm.
them. And we don't really address it. It's just like, oh, yeah, men don't live as long as women. It happens. And so I think it's good
Yeah,
to look at this.
yeah, I think so as well. I think both of us have talked about this sort of off air before, and we don't see, even though we do a lot of like general practice, we don't see a lot of men in our practices, and that's how it is basically in all forms of medicine. Men don't tend to go see their doctors or other healthcare
Mhm.
providers, very often until things get really, really bad.
Yep, and then by then it can be too late. The first thing I usually hear from men who come in my office is they come in. I'm like, "Oh, what brings you here?" Is like, my wife or my spouse made me come in, and so
Yeah.
I'm here because she said I needed it.
Yep, absolutely. Like that's in my top three. It's the wife pushed them, they have erectile dysfunction, or they have immense pain. Like those are the kind of the top three reasons why most of the men that I see come in.
Yeah, and with erectile dysfunction, it's especially interesting because sometimes, at least for me, they won't even mention it in the first visit, even though that's why they're there. It'll be a
Mhm.
couple visits, and then all of a sudden they'll be like, "Oh, and is this something you can help with?" And then you realize that was the whole reason in the first place was to come in to
Yeah.
see.
Yep. Absolutely. Yeah. So before we dive into kind of the whys, let's actually look at some of the stats. So this is a presentation I did to our endocrinology society last year. So these statistics are still pretty up to date. Let's jump right in here. All right. So, what's killing men? So, heart disease is still at the top of the list at 24.3%. Cancer is just below that. That's mostly prostate cancer, colorectal cancer, and I believe lung cancer, kind of the top three for those.
Mhm.
Unintentional injuries, so accidents, 7.4%. But you can see there's a big difference between number one, number two, and then jumping down to number three.
Sure.
Going from the 20 percentiles to down to 7.4%. So big gap there. So we're going to kind of concentrate more on the heart disease and cancer aspect because especially with these two, they're chronic conditions, and most men don't actually do something about them or get diagnosed until late stages. And then obviously, your options for treatments are more minimal at that point, and they're more progressive. They're higher interventions, right?
Mhm.
Medication, surgeries, chemotherapy, radiation, things like that.
No, that's true, and that's usually when I see people is like, "Oh yeah, it's been going on for a while. I didn't get checked out. Now I'm in stage 3 or 4. Help."
Hmm. Yeah. So this next chart is it's kind of the prevalence based on age group. So you can see top left hand corner, ages 1 through 19, and then 20 through 44. The top ones are unintentional injuries, so those accidents again. But look at the second one, which was pretty astonishing to me when I first saw this chart. It's suicide. That's pretty high percentage, especially at the 1 to 19-year old. That's 26.3%.
Yeah, that was shocking to
That's
me too.
yeah, that was surprisingly higher than I had anticipated. And then moving on to 45 to 64 and then 65 to 84, again, cancer and heart disease are at the top of the list. And when you get above 85 years old, those two are still at the top of the list. They just kind of flip flop as far as 1 to 2 goes. So you can kind of see there; those are kind of the top of the list according to age groups. Any thoughts so far, Mike?
Yeah, I mean, the suicide one for me was huge when I saw those numbers. I'm like, that is
Mhm.
insane. Under 44
Yeah.
years old, it's pretty much almost all injuries or suicide.
Yeah.
And mental health is a huge part of what we're going to be talking about. Not only for
Mhm.
suicide, but even for heart disease, because mental health plays a part in that, and it can even in cancer as well. And I think we lost him. But yeah, so it plays a big, big part. So if with suicide, you're going to have a lot of depression, anxiety, stuff like that. So, and then with heart disease, stress, anxiety, stuff like that is also going to play a big, big role. And so, yeah, it's pretty rough. And then we got Alzheimer's disease. Once you get above 85, becomes a big one, as well as injuries. So it can be pretty crazy. And then, you know, uh, cancers, some of which are preventable, or even stuff that, you can help with lifestyles, especially lung cancer is a big one that we'll also talk about. So,
Mhm. Yeah. Yeah, I agree. Yeah, we'll dive in more to like the mental health aspect of like suicide, things like that here coming up. But let's go on to the next one. So these are trends in age-adjusted cancer death rates. So you can see from many of these, they've actually gone down. So this goes back to several decades ago, and the trend sent up into like 2020. So you could say, let's take for instance stomach cancer. It's over 40. So this is a rate per 100,000 male in the population. So you can see it's steadily declining. Colorectal cancer, kind of plateaued all through the 60s and 70s, but now is on the decline as well.
hmm,
Prostate cancer kind of peaked in the 1990s, but now has really started to drop in incidence. Liver cancer, leukemias, like leukemias are kind of holding pretty steady. Pancreatic cancer, you can see, has been pretty steady as well. I'm not seeing a lot of decreases in those. But look at lung and bronchus, so lung cancer here. I mean, this made sense. Huge increase up until like the 80s and 90s when we started implementing things like not being able to smoke in restaurants and public places, right? And we're
mhm.
starting to see a huge decline in those numbers since.
Yeah, and it makes sense. It's a lot of it's preventable, and it's not always from smoking. There can also be environmental stuff. There can be work stuff, but
Mhm.
overall, it's a huge drop from. It looks like at its peak, it was at 90 per 100,000, and now it's down to about 40. So, I mean, that's a big drop.
Yeah, so there is good news here, right? It's like, all right, we're making some progress here as far as cancer in males, and we're seeing for the most part, most of these are declining. As awareness becomes more prevalent, and we've got better tools to treat these things, and but still, when it comes to cancer, kind of the name of the game at this point in time is still early detection, right?
Yeah.
And so that's where we're really pushing, especially for things like prostate cancer. Like, guys, get that checked out. If you're 50 and you haven't had a PSA or a digital rectal exam, which I know you're not lining up for those, but that's something that should be done. If you haven't had it done at age 50 or higher, like you need to do that.
Yep.
Most
Yep.
of these cancers, as long as you can catch them early on, the treatment options are going to be a lot greater than if you just wait until they become symptomatic. At that point, your likelihood of metastases goes up quite a bit.
Yeah, same, especially and also colorectal cancer. A lot of people don't want to get screened because it's uncomfortable,
Yeah.
And then I've had multiple friends who have gotten late stage colorectal cancer at younger ages, and a
Mhm.
lot of it was preventable if they'd gotten a scan years before. And it's like, oh, I don't need to. I'm not that old. I'm not that old. And I've heard the
Yeah.
recommendations even getting pushed down to 45 for some people to start getting
Yep.
tested.
Yeah, that's across the board now. So that this happened just this last year. Sort of general guidelines at this point are have dropped from 50 to 45, and that's across the board, male and female. Now it drops to 40 or even earlier than that if you have a strong family history of colorectal cancer, or if you have a personal history of inflammatory bowel disease like Crohn's or colitis. It really, honestly, any sort of major like bowel issues, like come on, you gotta you got to be on top of this. And colonoscopy is one of the better ways that you can make sure like you're getting screened.
What do you think about the blood testing for blood and stool as far as
Yeah.
testing?
So like Cologuard or just doing a fecal occult blood test. Yeah, absolutely. So this is kind of what I'll jump to first, especially if I'm getting a lot of pushback from a guy or a female as well, and they don't want to do their colonoscopy. It's like, well, all right, this is your life, this is your health. Like, I'm not going to push you to do anything, but oftentimes they'll compromise and they'll do that. So the fecal occult blood test just looks for blood in your stool, which can be there for a number of reasons, but one of those can be, early stage colorectal cancer. The other one is called Cologuard, and that actually looks for both blood and these weird sort of alterations to DNA, which again could be, a sign for, early stage colorectal cancer.
Yep, and I've used those before. I've had people use those before, and it's great because it's not expensive. It gives a peace of mind, especially if somebody is pushing you back of like, I'm 46 years old. Okay, I'm not going to get a,
Mhm.
a colonoscopy. It's like, okay, at least do this. Let's at least get your blood work, do this, and
Yeah.
see if there's anything to be concerned about.
Yeah. Yeah, I agree. Like, at the least do that.
Yeah.
All right.
Speaking of all you guys out there, get it checked.
Yeah. Yeah, I agree. All right, so let's jump back to kind of the heavier hitters. So like heart disease. Let's look at some of those numbers. Most of these numbers are coming straight from the CDC. So 350,000 men die of cardiovascular disease every year. So it's about 1 in 4 men.
Wow.
Half of those men who die suddenly of coronary heart disease had no previous symptoms. That's half of men. So their first symptom was death. And
That's
so that's,
insane.
yeah, that doesn't bode well. So again, these are things that there are things that we can do to kind of screen for heart disease, even when it's asymptomatic. From 2013 to 2016, it estimated that 47% of men above the age of 35 had hypertension. Now that's pretty significant. So half of men above the age of 35 had high blood pressure. Um, there's a reason they call hypertension the silent killer because it's damaging your blood vessels. Think about it. I mean, just simplistically, like if you have a closed system, pipe, and you're increasing the pressure in that closed system. So, like inside a house, for instance, in the plumbing, and you're increasing pressure, there's only so much time that you can maintain that high pressure before something gives, right? And you're going to blow something out. Same thing happens inside your blood vessels. That's a closed system. So if you're
Yeah.
running at a high pressure for long periods of time, months to years, at some point something's going to blow.
Yeah, and a lot of people don't even know what high blood pressure really is. I mean, I'll see people and I'll ask how their blood pressure is, and I'm like, it's great. I'm down to 160 over 110, and it's like doing really well. And I'm
Yeah.
like,
Mm-hmm. Yeah. Yeah, we tend to really concentrate on cholesterol when it comes to cardiovascular disease prevention, and we kind of really hone in on the cholesterol aspect. But I really try to engage with patients and educate them as to like what the bigger risk factors are, and that's things that damage your blood vessels, and that usually comes in the form of high blood pressure. So a lot of pressure there, high blood sugar. That's why diabetics
yeah,
have exponentially higher rates of cardiovascular disease. And then chronic inflammation. So if you got a ton of inflammation from a poor diet, poor sleep, whatever else it might be, you might have an autoimmune condition or something else. Those are all three things that are going to damage your blood vessel. And that's why like you can have normal cholesterol levels and still develop cardiovascular disease because you're still damaging the inside of your blood vessels.
and it's all connected in Chinese medicine. I mean, you get this high blood pressure, which can be caused by heat, or you talk about
Hmm.
yang rising and heat, and basically it all goes to your head, and they look at it as like, things are not able to move as much. So you have this buildup of heat and pressure, which eventually damages your heart and it damages other organs. And you're talking about
Hmm.
diabetes, sugar causes a lot of heat and damp in Chinese medicine, which again affects
Hmm.
blood pressure. It affects your blood vessels. So it's the same thing as usual. It's just a little bit different terminology than you're used to.
Yeah, yeah, that's fascinating. I mean, that's we've said this before. Like, I love Chinese medicine in that it's been around for so long, and they were just really great observers, right?
Mhm.
Even though they may have not had sort of the medical like dialogue that we have today, like where we understand it better at a physiological and biochemical level, but they were great observers, and so they're saying the same thing, just in a
Yeah.
different sort of format, right?
Absolutely, and same thing for inflammation. Inflammation shows up for most people as heat, and it can
Mhm.
and then that can cause the same things we're talking about. So it's interesting that these mechanisms all kind of connect together.
Yeah, yeah, I agree. Last thing on here, men tend to develop heart disease 10 to 15 years earlier than women do.
It's
So
significant.
there, yeah, that's again, it's the sort of average age of first heart attack. If a guy's going to have a heart attack, is around mid 50s, and so think they're developing that heart disease back in their 30s, right? And not doing anything about it.
Oh man, I'm glad we're talking about this important stuff.
Yeah, absolutely. Cancer, more than 700,000 men diagnosed with cancer each year. 230,000 of those are prostate. 300,000 of those cases will result in death. So almost half of those are going to result in death. The cancer
Wow.
mortality rate is higher in men than women. So you're looking at 189.5 per 100,000 versus 135.7 for women. Now, the good thing is this has declined almost 2% since the 1990s compared to women at 1.4%. So we are seeing a little bit better decline over the last couple of decades than women are. So that's some improvement, but still, these rates are pretty darn high.
And it's stuff that a lot of times, not everything, but a lot of them can be screened for fairly easily, like we talked about earlier. So it's even more important
Mhm.
that you keep an eye on it. You're probably fine. Yeah, you're probably fine. You still need to get it checked.
Yeah. I mean, look at the prostate one. Like, that's an easy one. Just regular PSAs, digital rectal exams, like, just this one is one too that, most men as we get older, we're going to develop a high percentage of us are going to develop prostate cancer. But the idea is we want to die with prostate cancer, not from prostate cancer, right?
Mhm.
And so that's a big distinction there. A good percentage of these cancers don't make it outside of that prostate capsule, right? Which is great. But if they do, it's nasty. You've got a lot of crucial things right around that area, like your spine. If you metastasize to your spine, that's pretty bad.
Yeah.
So again, a lot of this can be, treated and dealt with much sooner. It just as long as you know what you're dealing with there. So,
What I find interesting also is the Chinese actually first talked about cancer 1,800 years ago in one of their medical
wow.
texts. And like they realized 1,800 years ago that this was an issue because they were doing freaking
Mhm.
autopsy. That's like crazy if you think about a timeline.
That's nuts. So I'm curious, how did they talk about it?
Well, at the time, it was mainly supportive because by the time they had found it, they're like, it's
Mhm,
in bad shape. So we're going to find ways
mhm,
to support your health and increase your quality of life. Basically, that was the
mhm,
big push in the early days. And then as it went on, they started talking about, things you could do for the actual cancer. But nowadays, what we usually do, which is really effective, is people will get standard Western medical treatment, any surgeries they need, radiation, chemotherapy, and then we support both, what they're going through with their body and the side effects of those medications. And that works really
mhm.
well, at least from my perspective.
Yeah, that's a good point because, a lot of people kind of shy away from the idea of chemotherapy and radiation because I mean basically the idea there is we're trying to destroy the cancer before the treatment destroys your body, right?
Yeah.
And yeah, it seems pretty rough, but at this point, for various types of cancers, that's the best that we have. Now, are we going to look back 100 years from now and go, "What the heck were those guys thinking about?" Like, yeah, probably so, right? Just like we do, like bloodletting and the use of mercury, back 150 years ago.
You're not still using
But
mercury in your treatments? What?
I like to roll it around in my hand, So yeah, so granted, like yeah, there will be better treatments, immunotherapy and stuff like that as it develops. We'll have better tools, but at this point in time, it's rough. And this is, I think, though, where sort of complementary medicine, acupuncture, and naturopathic medicine really shine
Yeah,
because we can help keep people healthier as they're going through these treatments, and they tend to have better outcomes. Like once the cancer is gone, or once they're in remission, at least, like they have a better quality of life, they recover better. So there's still a really good place for complementary medicine right now,
yeah,
even though it's cancer.
yeah. And I've worked with oncologists before. I've helped people
Mhm.
go get checked for cancers before that they never even thought about or looked at because I was able to spot something that they just
Mhm.
didn't know about or see. And so it's a big part as far as prevention as well as treatment.
Yeah, and that's a good point. Prevention is still the name of the game now, and most of these cancers, a high percentage of them, are going to be um, they're going to be enhanced by poor lifestyle decisions, right?
Yeah.
And so, if you've got a bad diet, you're very sedentary, you have poor sleep, you got a lot of stress, like that's just like the perfect storm for turning on those genes to make all sorts of tumors, right? So
So if you're an
it's still
American
to
business
this.
person or stressed worker,
Yeah.
gee.
Oh, yeah. I mean, Western life, like we see it's consistently cancer and heart disease, which are going to be more those chronic degenerative conditions like that, based on lifestyle or perpetuated by poor lifestyle. We
Mhm.
see those much more at a higher rate in westernized sort of countries.
And that's what I work with a lot on people, honestly, is like as they're getting treatment, I also talk about lifestyle stuff. Because traditional Chinese medicine, it's going to be a lot of not processed foods, not processed sugar. You're
Yeah.
going to be eating a lot of whole foods, vegetables,
Hmm.
good quality meats. I mean, good quality, like not garbage that has a bunch of chemicals added. But if you have a local
Hmm.
farm, it can actually be cheaper and you're getting good quality grass fed meat that's going to take care of your body a lot better and really focusing
Yeah.
on things you can be doing at home, even if you don't currently have something that is killing you that you know of.
Yeah. Yeah, that's a good point. It's we tend to want to jump to these crazy, very dramatic sort of interventions as far as even like prevention. Oh, I'm going to go vegan, or oh, I'm going to go carnivore, or you know whatever else sort of kind of very dynamic sort of intervention there. When most of this is just figuring out how to be just moderate across the
Yeah.
board on a lot of different things and just developing a good healthy lifestyle that incorporates, I call it the core four, so it's like nutrition, activity, sleep, and stress management. Like if you're intentionally trying to improve all four of those, you're going to go a long way to decrease your risk for a ton of different things, especially cancer and heart disease.
Absolutely. It's all about balance. I mean, that's what they say in with acupuncture is like yin and yang. It's a balance. You need a little bit of
Yeah.
this, a little bit of that, not too much of any one thing.
Yeah, I think that's a great approach.
Hmm.
So overall mortality rate, 41% higher for men than women, higher for men in 8 out of 10 leading causes of death, including heart disease, cancer, stroke, and diabetes.
So crazy.
Again, yeah, we'll talk about why that is coming up here and what can we do to drop those numbers.
Mm.
Some contributing factors. So only 60% of men get their yearly physical exam. 20% of that is because of their nagging partner. So
Yep.
I'd say that's pretty consistent, if not conservative numbers, in my opinion. 40% of men won't go to a doctor until something is seriously wrong. Again, I think that's pretty conservative. I expect that to actually be higher.
In my experience,
My
it's
three, yeah, same here. So the three P's for going to the doctor, and this is kind of what I alluded to earlier: pain, partner, or penis, so erectile dysfunction. Um, 31% of men will suffer from depression in their lifetime. That's a huge one. I mean, that's yeah. that going back to the whole suicide aspect,
Yeah.
and that's massive.
And some of that's cultural,
Oh,
I think, too.
cultural, yeah,
Yeah, and
yeah, I
people just
agree.
don't wanna talk about their emotions, especially the older generations, like, they don't talk about their
Mm,
emotions at all.
yeah, yeah. Almost 10% have daily feelings of depression or anxiety, but only about a quarter of those talk to a mental health professional, and about a third of those take medication. Again, I think these are pretty conservative numbers. Um, I'd say, probably in the 30 to 40% of men that, as I develop a good relationship with them, will open up and say, yeah, I get depressed pretty often or overwhelmed pretty often, because of the pressure that they feel that's being placed on them or they place on themselves, as being a father, a husband, sort of the main breadwinner or, whatever else kind of pressure there. And men just aren't as good at making connections to other men to kind of talk through those things. So then it just kind of builds up, you know.
And they don't wanna be seen as being weak, and, I mean, it's
Right.
not, by the way. If you're listening to this, it's not weak to deal with feelings of depression and anxiety, but that's the way it can be perceived by some people, and that can make it really hard.
Yeah, absolutely. I think that perception is changing. Like
It
you
is.
definitely see a shift in, men in their 20s and 30s and like early 40s compared to men like in their 50s, 60s, 70s and so on. Like that sort of generational shift I think is coming. The younger guys do tend to be uh, they tend to open up a little bit more about their
Mhm.
emotions and sort of how stress is affecting them. And it's interesting because this doesn't emasculate you by doing that. And I think that's kind of the perception of the older generation is, well, I'm just got to tough it up, pull myself up by my bootstraps, and I'm the only one that can make this happen.
Yep.
And that's a very isolated way to look at it. And it's just I think you eventually realize you can't do this by yourself, and you shouldn't have to.
Yep, and it's contributing to killing people. I mean, if you're hearing this and you're in your 30s and you're thinking, "Oh, this isn't relevant." No, it's relevant starting now. Like, getting your life
Mhm.
under control, getting your anxiety and depression under control can prevent
Mhm.
you from having some serious medical issues 20, 30, 40 years from now.
Yep. Again, going back to that prevention piece, you got to be thinking about this proactively, decades ahead of this. So,
That's one of my favorite
and
questions you
yeah,
ask as a doctor a lot of
mm,
times
mm,
is like, you ask, how you want to live better, like a better life now and in the future, and what are you doing it for? And I always
mm.
thought that was a great question.
Yeah. I mean, it's always nice to know, like, what's someone's driving force. Do they have intention into their health? Have they thought about, have thought through that? Not only
Yeah.
their family's health, but their own health. And how do they look like, or how do they think they're going to be in 10, 20 years? You know, doing the same things now that they're doing then.
Yeah.
Oftentimes, it's not going to look good. It's like, and guys realize this. Like, you're in your 20s and 30s, and you're pushing yourself, and you're working 12 hours a day, 6, 7 days a week. And it's like, yeah, your body can handle that. But then you ask them, like, well, do you think you're going to be able to do this in another 10, 20 years? And I mean, if they're being honest with themselves, they know they're not going to be. And so
Yeah.
there needs to be some kind of change that happens.
Absolutely.
And then the last one here, more than 60% of adult men are overweight or obese. That's gonna, I mean, that's just gonna wear you out. You're carrying around 20, 30, 50 extra pounds on you. Yeah, I mean, that's, I remember back in college, I got to volunteer to wear the pregnancy belt. So it's just this little belt that you wear that puts on an extra, I think it was 35 or 40 pounds in your
Mhm.
abdomen. And it just, the idea was, you get a sense of like how pregnant women feel, after lugging this thing around we only had to do it for 2 weeks. Oh man. I mean, I was 22, 23 at the time, in great shape. And after those 2 weeks, man, I felt beat down. I mean, it was tough and just it drained all my energy and my back started hurting. It's just like, and many of us are carrying this extra weight around, which we don't realize the effect that it has on us.
Yeah, and I think that'd be a good future episode for sure. Is talk about weight loss, obesity, America, and like as far as guys go, I think that could be a good one.
Yeah, yeah, I agree. All right, men's health relative to the past. So, are we making any improvement? We saw the chart earlier about cancer and how most of those cancers are declining. Are there some other areas that we can see improvements in? So we have seen an accelerated age-related decline in testosterone. According to an article published in the Journal of Clinical Endocrinology, this was back in 2007, a 50-year-old male then, back in 2007, had a 38% lower testosterone level than males back in the 1980s.
Wow,
Well,
that's
that's,
significant.
yeah, almost 40%. That's a pretty big decline,
That's strange.
over, 20 plus years maybe.
Hmm.
Yeah. Now, we can speculate as to why that is, and obviously, there's probably a lot of variables that play into that. Ones that kind of come to mind for me are, stress.
Mhm.
We talked about sort of obesity. Like we know those obesity rates are going up. With that, we're going to see drops in testosterone because men are converting testosterone into estrogen more the fatter you get, which is kind of tough because this enzyme called aromatase is what converts testosterone into estrogen. And that enzyme is produced by fat cells. So it's kind of one of those scenarios where the fatter you get, the fatter you get. The more
Yeah.
estrogen you make, the fatter you get. So it can kind of be a self-perpetuating sort of issue.
Yeah, I think the era of the cell phone hasn't helped a lot either. Because back in the '80s, I'll show my age here. Back in the '80s, like I just ran around all day. Like all the kids were like
Yeah,
out running in the woods and playing outside. And in
yeah,
2000, in the 2000s, all the kids are watching TV inside on a couch, or and I won't say all, but a lot. And I think that
mhm,
that makes a big difference because adults are doing the same thing. This 50-year-old male has this lower testosterone. It's like, yeah, I got tired from work, so I went home and I watched TV for 6 hours, and then I took a shower and went to
mhm.
bed.
Yeah, yeah. I completely agree. One simple thing that I do is just to have people track their steps per day, and that gives me a really good sense of how active they are. Because
Mm,
most of us will overestimate how active we are, and so
yeah,
I'll ask, how many steps a day do you think you get? Oh, I probably get like 8 to 10,000 steps a day, and then when we actually measure it, they're getting like 3 to 5,000 steps a day. It's like that's a big difference. Like that's a good
yeah,
place to start there too. There was also this study done a few years ago where they looked at incidence of all cause mortality, so everything that would cause death, and it was both men and women. And what they found was if you set for 6 or more hours per day on average, despite your exercise regimen, you still had a 40% increased risk of all cause mortality for the next 15 years after this
wow,
time period for the study. Yeah. And so the shocking thing was like, despite your exercise regimen, like, so if you have a desk job and you're sitting 6, 8 hours a day, and then you go and exercise after that, it still didn't really do much because it wasn't just about the exercise aspect, it was the overall activity level. And
yeah.
we're just seeing a huge decline with more desk jobs available.
Yeah, and I think that is a big clue into cause too, because 50 years ago, or over time, 100 years ago, people had to walk a lot more. People had to go a lot more places, and they were constantly moving because they didn't
Yeah.
have the amenities we do now. Whereas now it's just like you work from home on your computer, and then you watch TV from your couch,
Right. Right.
and then you work out for an hour. Be like, okay, I'm okay.
Yep. Yeah. Here's another slide. This is the Massachusetts Male Aging Study. This is a big one. There are some really great information that come from this. But as you can see here, this measured testosterone levels back in like the 80s, 90s, and 2000s. And you can see there's just a steady decline in the total testosterone. and that's what the blue is. And then bioavailable testosterone saw a 45% drop. Now, bioavailable testosterone, so just to kind of back up a little bit, most of your testosterone, guys, is bound to a binding protein. Now, there's two different binding proteins. One's called albumin, one's called 6-hormone binding globulin. Now, these binding proteins, they bind up about 98% of your testosterone. And the reason for that is it allows your testosterone to float around in your bloodstream for a lot longer. It increases what's called the half-life of that. But as long as it's bound to that protein, it's not free to do what it's supposed to do, like get into your cells and trigger all the things that happen from testosterone, muscle growth, stuff like that. Now, what bioavailable testosterone is the testosterone that's bound to albumin, which is what we call a weak binder, which means that your body can take off that albumin really easily. And now that frees up that testosterone to get into your cells. The other one, 6-hormone binding globulin, it's a strong binder of testosterone. So it's really tough for your body to break that bond. Okay. So that's the one that we really kind of pay attention to see as a sort of a functional look at your testosterone. So the problem here is many providers will just test your total testosterone, and that incorporates all of it, right? It incorporates your bioavailable, the bound up stuff with 6-hormone binding globulin, all of it together. So that doesn't really tell you functionally what's going on. That's why you want to look at a free testosterone or a bioavailable testosterone. That gives you more of a functional look at what's going on. So with that being said, you can see here, there's a 22% drop in total testosterone, but more importantly, there's a 45% drop in bioavailable testosterone, which is a much more functional drop, right? Or a significant drop because it's functional testosterone. So anyway, that's kind of how to read that chart there.
It's very interesting too, because testosterone in Chinese medicine is connected with the kidney and the jing, and what they believed is you have a certain amount, and it affects your health of just about everything. Your kidneys are kind of at the base of everything, and so as they weaken, it's going to affect your health across the board in a lot of different ways. And so it's an interesting connection that, and at least in Chinese medicine, as this drops, it's going to affect your health in multiple facets. It's not just, oh, you have lower testosterone. It's like it affects everything.
Yeah, I agree. Yeah, if you would have asked me what it was going to be, I would have said kidney. Just to throw
That's always the answer, right? You know the answer.
It's always the answer. It's like C on multiple choice. It's kidney. Awesome. All right. This is another one done. This was back in this was in Israel, and it's a little bit more recent, as far back as 2006 up to 2019. So you can see the red, the darker, closer to the red color is going to be earlier, and then the yellow is going to be most recent. So you can see across the board there, these are, as far as total numbers go, that we're seeing a precipitous drop there just over the last 2 decades in testosterone levels.
That's wild.
Yeah. Oh, that's it. Okay. So as far as incidence and testosterone, what guys are sort of dying from, that kind of covers the presentation aspect that we're doing tonight. So any takeaways at this point, Mike? Kind of what you kind of pulled out of this as being sort of most significant?
Yeah, I know it sounds a little negative and scary, but that's not what it's trying to come across as. What we're trying to do is make sure that we're actually paying attention, because as guys, I mean, we need to be focused on caring about the people around us, and you can't care about people if you're dead or really, really sick. And if you can prevent it and feel good in your 70s or 80s, like by doing small things, like why not do it? What does it cost you to do it? Almost nothing.
Right. And that's the thing is you got to be intentional, and you'll hear me talk, if you're a patient of mine, you hear me talk about that a lot. Like, be intentional about what you want to do. I mean, that's how we make any progress in any aspect of life, right? It's like, if you want to build muscle in the gym, obviously that's just not going to happen, right? You got to be intentional. You got to have a program that's going to be progressive, and geared towards like hypertrophy and building muscle, right? So if you want to be healthy and you're thinking you're listening to this and you're in your 20s and 30s, if you want to be healthy in your 40s and 50s and so on, like you need to be doing things now. You need to
Yep.
start setting up
Absolutely.
those habits now so that you can be healthier then. You can't just wait and be like, all right, once I hit 45, I'm really going to get back into it and get healthier again. Like that's too long. It's too late.
Yeah, and 40, I mean, I'm 43. I'll go ahead and tell my age on here. And 10 years ago, working out, eating made a much bigger difference than it does now. It still helps, but I have to work harder for the same results. It's diminishing returns.
Yeah.
So do it
Yeah.
when you're younger, and then you will have a lot less problems than if you wait until you're 45 or 50 and you're like, I'm working my butt off and I'm only seeing smaller changes than I would have 10 years ago. It's like, nobody's ever going to look back at the end of their life and like, I wish I would have worked out less. I wish I would have eaten worse. Like nobody looks
Mm-hmm.
back and says that. I really wish I wouldn't have got my prostate checked. Like,
Well, I don't know. I think Ronnie Coleman maybe one of those guys who said he would have worked out a little bit less. I don't know.
but
But
in general,
yeah, but
most people.
I get it. I get it. Like you're totally right. Like, how are we going to look back and go, I wish I didn't do these things that improved my health. I wish I would have done less of that and more of like eating fast food and
Yeah.
all the other sort of bad habits we end up doing.
Yeah, and cook some food, people. Like this is something that I do every night. It takes time. I
Mhm.
realize it takes time, but just cook some damn food. Like you don't
Yeah.
have to go to McDonald's. You don't have to go to Arby's. It's all garbage. It's absolute freaking garbage. Put it down and cook some rice. It's easy to make, and some
Mhm.
vegetables, which are easy to make, and some meat. And like
Yeah.
you're gonna improve
Yeah.
your odds and health over time just by taking that step.
Absolutely. And then just, take some time on the weekend just to kind of plan ahead, right? If you fail to plan, plan to fail. So just take a little bit of time and plan out what you're going to do, what you're going to eat, when you're going to exercise, all that kind
Mhm.
of stuff. What kind of stress management skills you're going to try to implement that week. Like, it literally just takes a few minutes, maybe an hour a week to kind of plan that stuff ahead. And the more you do it, the more efficient you're going to get. So it's going to take
Yeah,
less and less time as you get more efficient with it. So
yeah,
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 I agree, man. I think too, like understanding, sort of the natural progression of what kind of men do throughout our lifespan, kind of helps us re-engineer that. So it's like,
yeah,
when you're in your 20s, especially, like you're bulletproof, you feel bulletproof. Like you don't want to go to the doctor, you don't want to do anything else because man, your testosterone's at its peak. You can pull all nighters and still like function normally. Like it's just not on your radar, right? And then we get into our 30s and we start families and that sort of thing. And obviously, like you're going to push yourself to the back burner. You're trying to make a living. You're trying to make a life for your family. Like, yeah, that makes sense. And then you get into your 40s and your kids start getting older and you gain 20, 30, 40 pounds and you're just like, yeah, I should probably start doing a little something, but again, you're still focused on other things. And
yeah,
oftentimes it's not till we get into our 50s and something major happens, like a heart attack, that wakes us up. And honestly, by that point, there's only so much more that you can do. There's still a lot you can do, but there's still like, if you would have started 10, 20 years sooner, you wouldn't be at that point that you are now. So
yeah. And
that's kind of the main point of this. Yeah.
culturally, I think it's a problem too because we've kind of glorified the dad bod. Like as a culture,
Yeah.
it's like, oh, it's okay. Girls love the dad bod.
Uh-huh.
It's like, but
Yeah. Yeah.
you look at your health with your dad bod. It's like it doesn't mean you have to
Yeah.
be perfect, but you definitely want to lose some of the dad bod.
Yeah. Yeah. I mean, I had this happen myself. I get into my career and then I have 4 kids. It's like, you kind of make these adjustments and compromises, right? You just be like, oh, well, I'm not 20 anymore. Like, I'm never going to have a six pack again. And, it's just, but then when you realize it, like, you feel really bad. Like, you don't have the energy that you feel like you should. And you don't have to be that way,
Yeah,
it's just it's a matter of making some changes. And if you've got a family and that's part of the issue, bring them into the conversation. So
Absolutely.
it's like now, like we go to the gym as a family. Everybody goes. Everybody's into it, right? And so it's kind of a family matter, you know. And
Mhm.
boy, that's really increased my compliance heavily since we've started doing that.
I love that. I think that's great. And we talked a lot about prevention. I think my last takeaway would be if you haven't checked your blood pressure, if you don't like to go to the doctor, get a good cuff or go to someone, go to one of those little
Mhm.
things in the store, whatever, and just check it. See what it's at.
Yeah.
And if it's, Ash may have a different number because I know the numbers have changed. But I mean, if it's over 120 over 80, you need to start at least thinking that, okay, there
Mhm.
could be a potential problem in the future here.
Yeah. Yeah, I agree. Yeah, there are different. There's two major stages of hypertension based on those numbers, and honestly, most of the guys I see are in stage one, sometimes stage two hypertension. By the
Yep.
time they get to me, in their 40s, maybe 50s. So, yeah, I agree. Get it checked. If you don't want to go to the doctor, at least buy a cuff and start checking it yourself. It's a good
And I
idea.
just want to say, man, it is so good to be back here. Focus, man. It's going to be great. You got four
Yeah,
kids. I got three. We
absolutely.
could talk about protection in the future. No, I'm kidding.
Right. Right. Yeah. 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 We won't be diving into infertility anytime soon between us, but
This is great, man. It's really good. And
yeah.
I think that this is going to
Yeah.
help a lot of guys. So, guys, thank you for listening. We appreciate it.
Yeah, absolutely. Just stay tuned. We've got a lot of great material coming for you guys. We're really going to dive in deep to a lot of different issues pertaining to men's health. If you have questions or if you have topics that you want to, um, you want us to dive into, let us know. Okay, comments, and we'll try to get to as many of those as we can.
Yeah, we'll answer everything we can, but keep tuning in. We're going to be hitting a lot of awesome, fun subjects this year, and hopefully give you
Mhm.
some insight on what you can do to improve your health and be stronger and better for you and for your family and community.
Absolutely. So for Mike Johnson, I'm Dr. May. This is East Meets West, Integrative Approaches to Men's Health. Again, thanks for tuning in, and we'll see you next time. Take care.